Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to try to do something today. We're going to go back and take some real good videos that we've had on different subjects that is associated with pediatric dentistry or children's dentistry, and anybody working on children or young people that needs to know these things. And so we've been pushing the Dental Society to have pediatric dentists do certain amount of orthodontics work that is associated with children coming up, so that they can do this one thing when they start out, and if somebody comes along that's very small, do these things. And so we hope they'll continue to do that. So let's get into pediatric orthodontics, and this is ectopically erupting, and this is something that everybody that works with kids ought to learn how to do. So I'm going to start out here, and we'll change over to show this person. Let me see if I can get her up again. Oh, there we go. All right, thank you. This is a real sweet little girl, and she I think her mother took a course with her dentist several years back. So this young lady is grown now, but we saw her when she was just a little girl, and she had an ectopically erupting 6-year molar. I think it's on the right side, I'm not sure, but we'll show you how we did it. This is her face. She was just a joy to work on, and we enjoyed seeing her. Now this tooth is back here in the back. And when we talk about ectopic eruption, let me kind of explain that just a little bit. I know that a lot of you know about that, but let's do it. So you have a deciduous tooth sitting here, and another deciduous molar over here, and then you've got a 6-year molar comes in at an angle, and a lot of times there's something like this, and they get right up here to this. They're tilted over, and the roots of the baby tooth are kind of out like something like that, and this will eat under the root. And when it gets to the enamel, it doesn't have any effect on it. But this tooth keeps growing up like this, then you will lose this tooth early. Now, a lot of times it'll literally dissolve the root of the tooth back in here and even up inside, but the enamel, it doesn't dissolve. So if you lose this second deciduous molar right here, then this 6-year molar is going to erupt up in this area, and if you get a hold of it and straighten the thing up, you're up here and you've taken the room for the second bicuspid. And so if you don't go in and upright this and put a space maintainer, a whole lot of trouble to go to. If you learn how to upright this tooth, you come in and put a little deal on here, put a deal here, and you go there, and you can go up and hook this to something on another tooth that's over here. You have a wire you bond onto the teeth, and you can take this, measure where you're going to put this hook, and this hook will come around something like that, and you bring it up and hook it to the back side of where you bonded this wire on the teeth. Because when this tooth goes up and goes in this direction, this wire has to slide back here. I'll show that to you in a minute on the x-ray, and you'll understand. We've got a perfect example of that. So here the wire is already laid out. We've bonded this, or we had, you don't have to put brackets on them at all. You can just bond this wire up there, but this one we use brackets, and we put a little piece of wire in there, and this is what we had. In other words, this is the deciduous tooth that has, the root is being eaten away, and if you look carefully over here, this is the 6-year molars coming in like that. And we had to, you bond something on here where you put the tube on it, and then you come in and you make like your tooth is laying like this, and you bond something on the side of it so that you can put this tube in here, and then you can come out and make this. But you can only put so much activation in it to get it up on this other eye. So when you get it activated up here and you want to add to it, you take a double optical plier and you can bend that and make this wire want to go down here, and it'll pick that tooth right straight up and bring it out of that hole. Don't grind it off, let it run into something up above, and it'll flatten it out as it uprights. All right, let's get on through this. Now here, the little spring that we used is just, you have something come out like this, and you can wrap this around a couple of times, and then you can come down here, and you have to come out and figure out where you're going to put this hook. You see this wire goes up here and double over and hooks on that. And this wire is down here, so when we pull it up there, it's got a lot of pressure on it, and it's going to tend to move this tooth back. So I want everybody to understand how they work. Now we'll go in, and here the little spring is in, and we raise the tooth up. You see, it's coming up like that. And this was down here, raised it up here, but this hook was over here to start with. Now that tooth raised up, pulls up over here, this slides back in this direction. Now, all right, here it is. Down here it's in a pretty bad shape. It's eating the roots out from under this tooth, and if you leave it alone, this tooth will be lost. This tooth will come up in here, and then you're going to have a real crowded problem. You either have to extract some bicuspid, or else you have to move this 6-year molar back where it originally was, and it takes a lot of effort to do that. So if you can come in and you know about uprighting the teeth and the ectopic eruption, let me show you what happens in here. Now here, the person came in, and the 6-year molar is sitting right in here. And look how it's eating the root of this tooth away. But it doesn't run, the tooth is still vital, even though the root is absorbed away. The blood vessels and everything to that deciduous tooth are normal right there. And so we put this on there, and you think, well, this is going to come up here. It doesn't. You raise this up and hook it behind one of the deals, and as this tooth comes up, the roots are in the bone down here. And as it does, this tooth is going to move back in that direction. And so we'll watch that as it comes up. There it is, part of the way up right here, and it looks like that. You have to get on the side of the tooth somewhere to put this prize on it. And it raised it up and pulled it out of there. See, this tooth has no root on it at all. Here is the second bicuspid, and that needs to come right up in here. Now this tooth is back. We leave it on a little longer, and this tooth will move back further. Now here it is, that this root slid from here over to here. As this tooth moved, this tooth right here was down in this area, see, like that. And this still was on it, and it pushed the tooth back in this direction. Now if you keep this pressure on it a little bit longer, maybe you can tie this tooth to this part up here, and it'll move this tooth up, and you'll have it right behind, and you use this deciduous tooth as a space maintainer for the second bicuspid to erupt into the mouth there. All right, there it is like that. And there's the little spring that we actually used. You can make these yourself. They usually use a rectangular wire. That's about a 17-2-5 wire, and you can make the little part that's going to go in the tooth, in the groove over here, and then this wire here would be way down here. You bring it up and hook it to the other wire, and the force on that picks that tooth up and moves it in that position. And there it is, looking at it from another angle. Here's the spring over here. Here's where it is moved back, and it moves this tooth. This tooth was down underneath here. Now, every dentist that messes around with children's orthodontics ought to know how to do that. And you don't need to send them off to somebody else. You ought to be able to do that yourself. You can bond this on. You take electrosurge and uncover that down there and put something on the side of that tooth. Make it very simple to make that little spring. And then you've got to put it up. If you want to add the activation, you take a optical plier that's kind of up like that, and then a bar down here, and you mash it, and it'll make this wire go down here. You can't put it in with the wire sticking them in the gum. They raise it up and hook it over here, and as this tooth comes out of here, this hook is going to slide back in this direction. Now, everybody that works on kids, ectopically erupting teeth like that coming out of the baby teeth, if you leave it alone, this tooth ends up way over here, and then you don't have any room for this bicuspid that's coming in underneath here. And so this is an important thing for pediatric dentists and for general dentists or anybody that's working on kids. You can be out in some country town where there's no orthodontist anywhere. You ought to learn how to do this. And it's a very simple, easy thing to do. And yet I can't get the pediatric people to start teaching pediatric dentists to do this. So we in the American Orthodontic Society are dedicated to teaching pediatric dentists and general dentists anything relating to children as they grow up and they get older. And I hope you understand this. And here it is like it is there. And we'll see it again. If you don't do something to this, this is going to eat over, and you'll eat the whole tooth. You'll lose this tooth. This 6-year molar will come up over here, and then this bicuspid can't get in, and it screws up the whole work. Now here's the second molar behind it, and you say, well, this can't go back there, but it can. If you raise this up, it'll shove this tooth back, and even the wisdom tooth, this one right over there, and you don't grind it off, it'll pull it up like this, and they'll chew against it, and it'll level the tooth out, and it works like that. And brings it up, and you chew this, it'll go down. And here is this little girl, and we brought this tooth up, and I'm sorry I don't have the picture at the end of this, but you keep this on, and you come back here, and you tie something to this, and we'll pull it up and keep it, and you can put this tooth right here. I'm sorry, you can bring that thing, well, I'm screwed up here, I've got my marking is off, but it'll pull this tooth over up at that spot. Thank you for watching, and we want to be able to put this onto our journal and pass it out so more people will see it. Thank you for watching, and I'm going to say goodbye, and we will hang up here.